Welcome, everybody. I haven't been on in a while in the group, but I wanted to get back in because I have a very special guest today. And I wanted to bring on Dr. Sherrie All. She is a neuro-rehabilitation psychologist, and she is the owner of the Chicago Center for Cognitive Wellness. And she's also an author. She has a new book out. It's amazing. I just purchased it. I have not read it yet, Sherrie. Yes, The Neuroscience of Memory. And I just felt like we all could really benefit from hearing from Sherrie on what we can do to lower our risks for developing cognitive decline, and to just get her input on what she does and how that could benefit all of us. So I'll hand it over to you, Sherrie. Tell us a little bit about yourself.
Yeah, thank you for having me, Corey. It's great to be here. Or shall I say Dr. Kiefner as well, right? So welcome. It's my pleasure to be with all of you. And so that was a really great introduction. My background is in clinical neuropsychology. I'm a licensed clinical psychologist who, I've always kind of focused on brain behavior relationships, what's happening in terms of memory, attention, executive function. And about halfway through my training, I learned that neuropsychologists are very good at telling you what's wrong with your brain, but as a field have not really been much in the business of telling you what to do about it. And that, just has a little bit to do with sort of how we used to think about the way that the brain worked. The adult brain we used to think was very fixed and hardwired. Now we know that adult brains are changing all the time. And so, if you've had a concussion, brain injury, you're experiencing some sort of neurological illness, that there's actually a lot we can do to try to hold on to function as long as possible, restore certain skills. And so I started the Chicago Center for Cognitive Wellness in 2012, really with that mission to kind of provide a what's next for people who had experienced some sort of maybe changes in their memory. So we work with a lot of families and individuals who are experiencing some sort of neurological change. Our biggest referral sources are other neuropsychologists who will kind of do an evaluation and then send folks to us to kind of help with the what's next. And so we work with a lot of families who maybe are early in the stages of a dementia diagnosis. We work with a lot of people, again, who've had concussions, brain injuries. And then we also work with a lot of people who are very worried about their cognition. And they've been to doctors, and doctors have told them, everything seems fine, but they just kind of can't get it out of their head, that every time they kind of forget something, they kind of panic.
Right.
And so we do a lot of work on that too. So the services at the Chicago Center for Cognitive Wellness include, we do the neuropsych assessments. So if you are worried about your memory, we can objectively test your memory to tell you, is it something you're just kind of worried about? Is it normal aging, or is something, scary going on?
Mhm.
And so we can do that diagnosis. And then we can also do a variety of interventions that are really on the mental health side of things. So we do a lot of counseling, and we do cognitive rehabilitation in a kind of an outpatient mental health kind of model, where we help you kind of develop new habits and behaviors that are kind of in line with helping you maintain as much independence as possible, improving your daily memory function, your daily attentiveness, and then also a lot of brain healthy behaviors to help you try to slow any kind of decline, or even, and Corey, you can speak to this maybe a little better than anybody else, but like how we move our bodies has a big impact on our memory function. And so healthy lifestyle, things like that can pay a really good dividends, or I use a little bit of an investment model talking about brain health, but that how we live our lives from day to day, how active we are, can really have a big impact on how sharp we feel, and then also for the long haul.
Right. Yeah, because often we think that, there's nothing really we can do preventatively. And you hear so many stories about, well, I don't want to know because there's nothing you can do about it. And it can be a very scary thing to get tested or to take those steps when you are worried, because you think, well, what can I do about it? And why I don't want to live with knowing this if I can't do anything about it. Like you said, we know we can do something about it. There are things we can do. And in the realm of, where I kind of specialize in being a physical therapist and a dietitian, is looking at those two lifestyle factors of, moving our bodies more, stimulating cognitively while you're exercising is kind of this new area that I've branched out into, which has been really neat. And then really looking at what we're eating, how we're taking care of ourselves. And then, all those other things like sleeping well and socializing and learning new things and things like that we can do that really have an impact that we didn't know before really could change the course of possibly a diagnosis.
Yeah, absolutely. There's a lot we can do. And we have the medical community even has treatment guidelines for people who are in the kind of the earlier stages of cognitive decline. So it's really important that people, if you're worried about something, get it all checked out. And because we I mean, again, we have like accepted treatment guidelines for what to do about it to really try to, stem the tide,
Right. Yeah.
whatever, whatever that phrase is.
Yeah. Yeah, exactly. And then that just empowers you too. If you and I think you kind of mentioned this in your book, as far as, when you are empowered with your knowing about your memory, knowing about your brain and understanding it, it empowers you to maybe be a little more motivated or be a little more accountable to doing some of these things. If you know, hey, these things are going to help me and I need them. If you're just kind of in the dark about it, it may not be very motivating to do all those things that can be very hard. Lifestyle changes are hard, and I think we all struggle with exercising regularly, eating right. And a lot of what I promote is not being perfect. We're never going to be perfect. It's not sustainable. But if we can 80% of the time, 75% of the time be making better choices and committing to movement and some of these other things, sleeping well, and really making that a priority in our lives, it can be really helpful for your longevity and your cognition down the road.
Yeah. Yeah. I appreciate you saying that. Like there's a big difference between knowing what to do and like actually doing it. Right. And
Yeah.
so one of the things I'm proud about with the book is that it's a workbook. And so there are lots of worksheets that are built in to kind of get you thinking about like one of the activities in the book is to really think about like what are your personal barriers to being more physically active, like because we know right
Right. Yeah.
but it's like sometimes we have these thoughts like, well, I can't go to the gym until I'm like a certain size, or I just don't like being sweaty or being breathless, and but the more we get aware of kind of what are those thoughts that are kind of getting in the way, that we can really shift and be more motivated and have more accountability, and so hopefully the tools that are inside the book are going to be helpful for folks to help with kind of
Yeah.
committing to new action.
Definitely. I love that idea of workbooks because writing things down, especially, like really helps you stay accountable to them. And,
Yeah.
I think there's a big difference between just, reading something, but then when you have to engage and kind of put yourself in that situation and figure out how you're going to make it happen, that's huge. So that's amazing. I'm excited to read
Yeah.
it. Um, but the other thing is, I always love your analogy, like you were talking about the kind of the bank account and the investment with cognitive reserve. So if you could just kind of tell everyone, like, kind of your thought process on that.
Yeah. I'll say a lot of times that I've kind of made it my professional mission to popularize this scientific theory of cognitive reserve. And so if you've never heard of this theory before, it's actually something that has been in the scientific literature for about 20 years now. And it's really based off of evidence that we were seeing at the end of the last century. So like in the 1980s and 90s, we were seeing a lot of evidence that it didn't seem to matter so much kind of what was happening to people's brains in terms of like the bad things. Like there were people who would get big brain injuries or have a massive stroke and have amazing recoveries, and then there were people who would have kind of a small a stroke or a brain injury and lose a lot of skills. And we were also seeing this in Alzheimer's disease, that there were people who had the same amount of Alzheimer's disease growing in their brains, who were sharp as a tack, didn't have a lot of cognitive changes, but they had the same amount of Alzheimer's disease as people who were really, really impaired. And so what predicts cognitive decline actually seems to matter. Like what happens to your brain matters, but what seemed to really matter more was that these people who were holding on to skills actually had bigger brains, and they had more brain cells left over. And so in the year 2000, a neuropsychologist at Columbia University named Yakov Stern published a series of papers where he sort of put together this data and collectively kind of synthesized it to say that the amount of cells and skills that you have stored in your brain bank is probably one of the best predictors of when you're going to kind of cross over that dementia threshold, which is where like memory loss that's worse than normal aging and it's bad enough to get in your way. And so each of us have kind of a level of cognitive reserve. I call it your brain's 401k account because it's kind of quite literally like your brain's retirement account. And so it's not just about kind of preventing losses, because so that's one investment strategy, right? Is to keep all the brain cells you can, because you're going to need them later. But also with a lot of the new neuroscience that's come out over the last 20 years is that we can also actively invest in our brain 401ks throughout our entire lifespan. And so adults are growing new brain cells. You might not have known that, but you don't grow a lot of them, so you got to keep the ones you have. But we do grow new brain cells. Mm-hmm. Being physically active, though, helps you grow more brain cells. So when people are more physically active, you're kind of popping out those brain cells. And then in terms of nutrition, and that if we eat a diet that's rich in antioxidants and omega-3s, then that can kind of promote some of the connectivity. Learning new things helps these baby brain cells kind of stick around, because when they're first born, they start off as stem cells. And so they actually need stimulation, mainly in the memory centers of the brain, in order to kind of be trained into being a new neuron. And so it really matters a lot what we do, and that we can actively invest in our brain 401ks like throughout the entire lifespan, which really does seem to make a difference in terms of lowering your personal risk for dementia down the line.
Yeah, that's me. I love that analogy, because it just kind of makes a little more sense to people of, how like investing in your health is so important, and especially for your brain health as you age. And and that's one thing I talk a lot about in this group a lot is, staying independent as we age. Really it really comes down to our brain health. I mean, that controls everything. So if we start losing that, we can lose independence and lose function and all of those things that we're all trying to avoid. And so now that we know that there are things we can do, and like you said, it's that accountability piece too of, how do we stay accountable to keep doing these things. But yeah, it's just an interesting analogy, and I think it really kind of makes people really think about, okay, I need to really think about this for my future. And I've often felt, prevention is kind of hard. People, they often wait until something goes wrong to really step in and say, okay, I have to do something about it. But, like we've talked about, that's what we want to get the message out, is doing these things before they happen is really key to staying independent and living a long, full life that is, that you're functioning well, and being able to care for your loved ones and all those things as we age.
Yeah.
So it's a great point.
And it's probably most important for brain health too, because like heart health, cancer, we have interventions for that. You can have a heart attack and then get some surgery and they can kind of repair your heart. We really have a way to repair the brain in the same way. And so prevention's really what we have in terms of really making an impact on, and I don't know if you've been clear about this, but we're really facing an epidemic of dementia coming down the line, and with the boomers moving into that age category that puts them at highest risk, and we're really expecting the prevalence to triple over what it was 5 years ago. And so and once people have kind of reached a certain level of cognitive decline, which is really kind of the moderate stages, it would be the point at which you would have a heart attack or like get diagnosed with cancer. At that point, we're really just trying to keep you comfortable, keep you maybe independent, but it's real more palliative in terms of the treatment interventions. That what we're really looking for is more of that prevention model, because it's not like we can wait until something bad happens and then intervene with the brain. At this point, we really do need to think about it from the prevention side is probably that much more important.
Right. Yeah. Yeah, exactly. Yeah, after you're already in those later stages or in that diagnosis, it becomes much harder to really reverse it, and change it. But
Right.
but yeah, and like what you were talking about too is, new cells and new pathways and things like that. That once we thought that it was very fixed, that old saying, you can't what is it? The you can't teach an old dog new tricks. We need to get rid of that
Right.
saying, right? Because you really can. You can learn new things. You can, create
Yeah.
new pathways. And so I think sometimes people feel like, okay, well, I'm kind of set in my ways and I'm not going to change things. But when we really know the research is there to support it, it makes it much easier to be motivated to do it. So,
Yeah, and the people who've had the most resistance to dementia are a lot of those folks who've committed throughout their life to, live a life of adventure where they're learning new things and kind of taking on new skills. Those are kind of what make up some of our super agers that
yeah,
we've studied over the years, and so
yeah,
it makes a big difference.
definitely. And then with your practice, can you talk a little bit more about, so you do the testing, the neuropsychology testing, and then do you ever refer for any like more tests as far as MRIs or things like more imaging? Just kind of tell people what you would kind of recommend, what the starting point would be if you're worried or you're starting to see some decline, and then how that picture kind of looks for a lot of your patients as they're coming to see you.
Yeah, that's a great question. So so usually neuropsychologists are psychologists, we're not physicians. So we're in a position to where we can do the most detailed, comprehensive testing of your memory abilities, and it's objective and it's norm referenced, kind of comparing you to other people with your similar background, your age. But we need to actually work hand in hand with physicians to be able to look at those other pieces. Neuropsychological assessment was holistic way before holistic medicine was kind of all the rage in the US. A neuropsychologist wants to know about everything related to your life, your symptoms, your physical health, your psychiatric health. And so it is important that as part of a neuropsych assessment, that the neuropsychologists do have some data on physical biomarkers like an MRI, blood tests. So a standard dementia workup would really kind of include work between a physician, which could be a family doctor. More often it's a neurologist, and then so the physician plus the neuropsychologist, and kind of taking all this data and putting it together. And so the physician's going to look for any kind of physical explanation for what the memory changes are going to be, which are really important because there are a lot of rule outs that there are a lot of physical conditions that can look like dementia that aren't, like low B12, or maybe even urinary tract infections in an older adult can present as like delirium. So, and then we need to know kind of what does your brain look like, and because part of what we're looking at is what's causing these memory changes, right? Does it look like Alzheimer's disease? Does it look like a vascular type of cognitive decline? Have you had maybe little strokes that you didn't know about? So we need to see the MRI. We need to see some blood tests to rule out things like low B12 or other conditions. We also, it helps to kind of get some detailed kind of sensory and motor functioning that a neurologist is going to do too, so they can look for things like maybe a tremor or changes in your gait. These are, some of the assessments that you do too as a physical therapist, right?
Right.
That kind of help us sort of narrow down like what's causing these memory changes. And then also the physicians are important too for a little bit of the what to do about it. So if they need to prescribe a medication, that's going to be the physician's wheelhouse. So it's really kind of something that we do sort of hand in hand.
Okay. Yeah. Okay, that's great information because a lot of times people don't know where to start. Who do I?
Right. Where do you start?
Yeah. What kind of doctor do I
I
go
say
to?
you start where you can get the next appointment, where you can get the fastest appointment,
Right.
right?
Right. Exactly. Yeah. A lot of times people are like, okay, I need to go to a neurologist, or do I go to my family practice physician, or you just don't know where to start because it's really not. As we've talked about with prevention, you're not really told. Usually, when you go to the doctor, it's because you have something wrong, and we need to really promote that you can go when you don't have something wrong, but you feel maybe a little worried about something, and that should be okay.
Yeah.
Um,
Yeah.
yeah.
My general advice is just to like, make the telephone rounds if you're kind of worried about this. Like call
Yeah.
your family physician, get that appointment,
Mhm.
call the neurologist and get on their books. So a lot of neurology clinics are booking kind of 6 months out in the future. Not all of them are that bad. So you could get a neurology
Right.
appointment like 6 to 12 weeks in the future. But then, also set up the neuropsych appointment, kind of get on that person's books too, because you're going to probably need most of this data. And then you can always cancel the appointment later if it seems like it's
Yeah.
not an important thing to do. The most important thing is to not sit around and kind of twiddle your thumbs and worry. And what I see a lot of families do, which is kind of heartbreaking to me, is that they sit around and they kind of tell stories, they make up explanations, well, they're just, it's just normal aging, or they're just being stubborn.
Right.
And it's like, we can figure this out. Like, let us help you, just
Yeah.
get on our calendar.
Yes, absolutely. No, I think that's great for people to know because a lot of times they don't know where to begin. So it's great starting point.
Yeah.
Okay, so tell everyone where they can find you and also where they can get your book.
Yeah, great. So if you're interested in meeting with one of our really well-trained clinicians at the Chicago Center for Cognitive Wellness, then you can find us online at cogwellness.com. So it's COG, like cognition, cogwellness.com. Or you can call us directly at 855-COGWELL, so COGWELL. And if you can also find me on that website, but I also have my own website, sherrieall.com, where you can find lots of different ways to purchase the book. You can buy it from me directly. We have links there for Amazon. We're also have the link there for Women and Children First if you want to support a local bookstore. So that's where you can find us.
Okay. Yeah, I thought that was great too that you went through a local bookstore to support them as well. So that was really cool.
Yeah, it's really nice.
So
Yeah.
I'll actually put the link in the comments when we post this. So then it's a little bit easier access for people to find you. But I wanted to thank you again for coming on today. This was really great, really a lot of great information.
Thanks, Corey. Thank you so much for having me. It's been a real pleasure to just be with you and meet all your Facebook people. And I hope we
Yeah,
get to the future someday.
yeah, definitely. And
Facebook people, I know you.
right, yeah, yeah, the Facebook. Yeah. So yeah, if anyone has any questions, you can drop them in the chat, and then I can always contact Sherrie, or I can answer them, and we can go from there. But thanks again, and have a great day.
Right.